Hi, my name is Kevin Gachee, consulting psychologist at Oasis Health Specialty Hospital, and today I'll be talking about depression. Depression is categorized as a mood disorder, and it's the leading cause of disability worldwide. It actually affects, according to the WHO, it actually affects at least 200 million people worldwide and 2 million Kenyans. There's no one definitive cause of depression. However, we know of factors that contribute to someone developing depression. One of them is genetics. You can be predisposed genetically the same way someone can be predisposed to get diabetes if there's a family history of diabetes. You can be predisposed genetically to developing depression. Another cause is substance use and abuse. Substance use and abuse has been shown to lead to the development of depression as well. Another cause is environmental factors. Environmental factors such as stress, trauma, or if you just live in an environment that's not conducive for your well-being, so to speak. Lastly, you have pre-existing conditions. It can be a physical condition such as cancer, for example, or diabetes or HIV. So what happens, these factors tend to cause a chemical imbalance in the brain, and as a result of that, someone develops depression. Some of the signs and symptoms of depression include persistent low mood or persistent sadness. There can be change in weight because either the person is overeating or they're not eating well. There can be a loss of interest in things that they found interesting. It could be hobbies, it could be academics, it could be work, for example, or any other interests. There's also thoughts of suicide or attempts of suicide, and also thoughts of self-harm or attempts of self-harm. And this we see a lot in mainly the severe cases. There's also a change in sleep pattern. You can find that either the person is not sleeping as well, or rather sleeping too little or sleeping too much. There can be irritability as well. And also on the other side, there's also physical symptoms of depression. And this include things like headaches, muscle pain, stomach cramps, just to name a few. Basically, with depression, there's levels. The levels are categorized as minimal, mild, moderate, moderately severe, and severe. So severe means your ability to function has been completely compromised. So maybe the person is not able to work or achieve their day-to-day activities or accomplishments. At that level, at that point, the person would need medication, because what the medication does, and the medication in this case is antidepressants, what it does is it restores the chemical imbalance into a balanced state. For people who have depression in the mild, moderate, moderately severe, and minimal scale, they can benefit from therapy alone, but people are individually different. There are some people who may require also some medication for a duration of time. Also, depression tends to be different, so to speak. There's no only one-size-fits-all type of depression. There's situational depression and there's clinical depression. Situational depression is based on situations or life events, and you find that when the person has been able to process the life event or overcome that life event, the symptoms now subside. And in that case, the person may need medication only for a significant or a short duration of time as they process the life event. But clinical depression is different, where everything could be going great in the person's life, but the person is still feeling depressed. And here, a lot of the time, it's the chemical imbalance playing the major role. And for someone with clinical depression, they may need to be on medication for the long term or rather we can even say, for the rest of their lives, because we haven't heard of any cure yet. The main thing is to reach out and seek help. It's very important that, if there's anyone out there going through symptoms of depression or feeling like they're depressed, seek help, because there is help. Recovery is possible. You're not alone. You shouldn't feel like you have to go through this by yourself. It could be even seeking help from a loved, or reaching out to your closest loved one and them helping you seek the help that you deserve. A lot of people are going through depression and it's untreated, and they feel like they don't have any support. And I know sometimes it's difficult to know where to go or where to start. One place you could come is Oasis Health Specialty Hospital, where all the staff here and the clinicians here and the therapists here are always ready to help. And the environment is very therapeutic and conducive for recovery. Another thing is just trying to live a lifestyle that's conducive or healthy for you. What I mean by that is, if you've noticed that maybe you're taking a substance too much, or your intake of a substance has increased, trying to cut down on that. Also, exercising helps. Also, talking to a loved one. Never feel like you have to bottle up the things that you're going through. Just having a conversation with a friend or family can also go a long way. And just practicing your self-care. Trying to practice your self-care as much as you can, because self-care is not selfishness. Women are more vulnerable or more predisposed to experiencing depression than men. However, men tend to have a higher suicide rate than women. For women, there are types of depression that tend to afflict women more than men. For example, postpartum depression. There's also a type of depression called premenstrual dysmorphic disorder, which affects women during their menses as well. So there are certain types of depression that tend to affect women predominantly. However, men tend to have a higher suicide rate. In fact, 80% of suicides in the world are men. And mainly it's because a lot of men out there feel like they can't talk about the things that they're going through or seek help without being looked at as weak or not man enough, so to speak. However, that big misconception is what has caused a lot of men to suffer in silence, and as a result, the suicide rates have been on the rise. Well, mainly it's offering a listening ear and just asking them, let them be the driver, so to speak. So just asking them, how can I help? What can I do to help? Don't tell them to snap out of it. Don't tell them that so many people are going through difficult things, because that you'd be minimizing and not helping them. Because at the end of the day, everyone's feelings are valid. They feel how they feel for a reason. It's not like they want to feel that way. So just offering a listening ear, asking them how they'd like to be helped or what you can do to help them, and just supporting them in seeking help, pointing them in the right direction, or guiding them for professional help. If there's a genetic predisposition to depression, it's very important that you live a healthy lifestyle. And what that means is, just being careful when it comes to substances, try not to abuse or overindulge, or, also it's very important that your environment is conducive to your well-being. A lot of people you find get afflicted by depression because of the environment as well, because the environment is very stressful or traumatic or toxic. So it's very important that the environment is conducive for your well-being, and this may even involve setting boundaries for your self-care as well. I think also therapy, you don't have to have a problem, or you don't have to have a severe mental health condition to go for therapy. Therapy helps in different aspects, in self-awareness, in you processing events, in you learning about mindfulness and how to take care of yourself, and etc. And just having the right people around you, because you're the company you keep. So just having people who have your best interests, people who you feel you can talk to as well when you're going through a difficult situation. Exercising is also important. The food you eat, the diet, it's important that it's a healthy diet as well. And I think just not being too hard on yourself. Just taking a day at a time, doing the best you can every day. And yeah.